So I'm often asked, what is a pelvic health specialist? And in general, a pelvic health specialist is often a urologist or a urogynecologist or colorectal surgeon who specializes in areas of pelvic health. Oftentimes, the physician has completed something called a fellowship. And so a fellowship is specialized training where they really do focus on treatment and evaluation and helping patients with very specific pelvic health disorders. And fellowships can last anywhere from 1 year to even 3 years. So imagine 3 additional years of training just in pelvic health. It's actually relatively easy to identify pelvic health specialists a lot of times. There is a particular certification. It's called a certification in female pelvic medicine and reconstructive surgery. It's a very long word. It's oftentimes just abbreviated FPMRS. And you can actually go online and check the board certification of your doctor and see if they're FPMRS certified. But again, pelvic health specialists, not only do they have additional training, but they tend to focus their practice. They've taken, if they're certified in female pelvic medicine, they've taken an additional certifying exam, and they actually repeat that certifying exam every 10 years or so. And so it requires a lot of dedication, a lot of knowledge, a lot of skill to maintain these certifications. A pelvic health center oftentimes is just a gathering of multiple pelvic health specialists. So here at Ochsner, we have a pelvic health center, and we have several specialists who include urologists, urogynecologists, colorectal surgeons, gastroenterologists, behavioral health specialists, pelvic floor physical therapists. And all of these different specialists, all of these different experts sort of combine their expertise to make sure that we're taking care of patients in the most efficient and the most effective manner possible. Another aspect that you'll often find with pelvic health centers, and that we feel like is a really important part of our pelvic health center, is a pelvic health navigator. Maybe you've had an experience visiting a healthcare provider for something, and then maybe being prescribed a medication or prescribed a treatment, and you get home, it's not working, or you couldn't get it, or something's gone wrong. And now you're trying to reach out to the office, or you're waiting until your next appointment. We found for pelvic health, that's really one of the most frustrating things that patients can encounter. What a pelvic health navigator allows us to do is, first of all, to make sure that a patient sees the right provider, right? So we have different pelvic health specialists that specialize in different areas of pelvic health, whether they're a colorectal surgeon or urologist or a urogynecologist. And our pelvic health navigator makes sure that that patient gets to the right provider in the first place. The other advantage of our navigator is that after that first visit, the navigator is checking up on that patient to make sure that she's making the kind of progress. And if she meets some kind of obstruction, some kind of a wall that's keeping her from getting better, it's the navigator's job to make sure that we can overcome that wall and help her to get on really a pathway to wellness. And pelvic health navigators are often a very important part of a pelvic health center. So in general, when we think about a pelvic health center, we're thinking about a practice that's really dedicated to the area of pelvic health. It brings a lot of different providers with expertise into one place and brings a lot of resources for their patient. Very interestingly, a lot of times when we think about a pelvic health center, we think about sort of one place or one building. But of course, as healthcare becomes less centralized, we actually find that many pelvic health centers will actually treat patients in multiple locations. Again, you're getting all of the advantages of all of that expertise, of all of that specialty training, of all of those resources, of the navigator, but you don't necessarily need to drive 2 or 3 hours to a specific building to receive that care. And I think in many ways, that's been one of the most revolutionary changes that I've seen in pelvic health centers in the 10 or so years that I've been doing this.